It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
I could lose weight. A lot of times I could try to lose weight. I would be able to lose weight, but keeping the weight off was impossible. It would always come back and I'd just gain more.
A local woman shares her weight loss success. It came after surgery and lifestyle changes. Is this right for you? Well, we're here to help you find out. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today we're focusing on weight loss surgery or bariatric surgery. The most common procedures are lap band, gastric sleeve, and gastric bypass. Our experts are going to help you understand the different procedures and how they work. If you're watching us live now and you have questions concerning bariatric surgery, give us a call. Your questions may be answered here live on our program by our experts. The experts answering your questions are Dr. Peter Nong with Rex Bariatric Specialist and bariatric surgery patient Bob Moore. To call us here at Rex on Call, just use the numbers on your screen. In Wake County, call 919-744-3876. Outside of Wake County, call toll-free 877-277-6252. If you're watching us as we stream live on WRAL.com, you can email us your questions at rexoncall@rexhealth.com. Or find us on Twitter, send us a message at Rex Healthcare, hashtag Rex on Call. And while you're sending us those questions, let's hear from Stacy Shaw. Stacy tried and tried to lose weight and could never keep it off until bariatric surgery. She chose a type of surgery that's gaining in popularity across the country. Here's her story.
To look at Stacy Shaw, it's hard to believe that she once weighed 260 pounds. She said nothing worked.
I could lose weight. A lot of times I could try to lose weight. I would be able to lose weight, but keeping the weight off was impossible. It would always come back and I'd just gain more.
So she opted for gastric bypass surgery in December of 2011 with Dr. Paul Enochs, a bariatric specialist of North Carolina. She chose the procedure called the sleeve.
I had the VSG, or the vertical sleeve gastrectomy, which is basically removing 80 to 85% of your stomach.
Dr. Enoch says this weight loss procedure has seen a surge in popularity.
It provides a bridge between the band and the bypass for patients who don't like the idea of having their intestines reworked and things moved around, but at the same time they don't have to have a device. It's the same restriction as a band, but without a device.
It was single incision, so I have no scars. He did it through my belly button. He's an amazing physician with years of experience, and I chose him specifically because of his experience, and I loved the single incision.
So with Stacy's smaller stomach, she eats less. Take a look at what an average meal looks like now.
This is an average salad that you'd be served at a restaurant. I would not eat the roll, so I'll remove that, and I'm going to portion out and show you what an average dinner or lunch might be for me. Primarily, I'm going to eat the chicken. An average amount that I would eat for dinner, it's probably 3 to 5 ounces, I'm guessing, without having a scale. This would be a completely satisfying meal for me. I would be completely happy after eating this and probably wouldn't eat for several hours after.
Stacy believes she would not have been able to lose the weight and keep it off without the surgery, and there's some evidence to support that.
Once someone has a BMI of 40 or above, or 35 and above with a medical issue, once they reach that range, although all those things are true, and if they do diet and exercise, etc., it can help them lose weight, only 10 to 15% of patients are able to lose the weight on their own and maintain it. That means 85 to 90% don't.
I felt like it gave me the best shot at maintaining the weight loss, which is the ultimate goal. I don't want to keep losing it and regaining it. I've done that multiple times in my life, and it got me all the way up to 260 pounds.
So quick again, who's eligible for weight loss surgery? Take a look. If you have a BMI or body mass index of 35 and higher with medical issues, or a BMI of 40 or above regardless of medical condition, if you also have a history of failed weight loss attempts, and if you're committed to maintaining your weight through proper diet and exercise. To talk more about that, joining us now are Dr. Peter Nong and Bob Moore. And Bob, you had this surgery. Let's start with you. It is not just surgery and you're done. There's a lifestyle to this, right?
There's a lot of changes you've got to do. You've got to eat slower. You've got to eat smaller amounts. You've got to exercise. And I think you've got to be committed to doing all three of those.
Okay, and so which surgery did you have?
I had the regular bypass. I had it 9 months ago.
And how much weight have you lost so far?
105 pounds.
Congratulations.
Thank you.
But it has been a process.
It's a process, and it's an ongoing process. So I don't think it's one that's going to stop anytime soon. It's one that you've just got to stay with it.
And in fact, we have a picture of you before, and this is just nine months ago. Wow, that's right. Yeah. And I mean, you still. I mean, you look great. And how much more is on the plate for you to lose?
I'm getting close to my target weight.
Yeah, you look
but
great.
I've still got probably 10 more pounds that I could lose.
You look great. You look great. Okay, Dr. Nong, can you quickly kind of run down the differences between those procedures?
Sure. Really, basically, the most common procedures done are the lap band, the sleeve gastrectomy, and the gastric bypass. They each are different. They each provide some aspect of restriction, so you have a smaller stomach. But the operations also work through hormone changes in your body, as well as what's called malabsorption, where you will absorb less. The sleeve gastrectomy, probably one of the more popular operations being done now, is really a simple concept. We make the stomach a long, narrow tube. Instead of a stomach that holds 2 liters, it'll hold around 150 milliliters. So we really dramatically drop the size of the stomach. The gastric bypass, on the other hand, we make a very small stomach, about the size of the egg, and then bring a small piece of intestine up and attach it to that. That not only creates restriction, but you absorb less nutrients, and that's why that's been so effective for many years.
Okay, and who decides which procedure is appropriate for the patient?
Well, you know, we work together with the patient. You know, I think there was a thought at one point that you just choose an operation and you move forward with that. And I think the reality of weight loss surgery, as we now know it, is you have to marry the right operation with the right patient. Each of the operations will benefit you with respect to weight loss a certain amount, and also address certain comorbidities, diseases like diabetes, high blood pressure, sleep apnea. So if we want to address certain diseases, we may direct you in one direction versus if you have less weight loss need, send you back in another direction.
Okay, we're getting a lot of questions. This is from Debbie in Lumberton. She had her stomach stapled in 1981. Is she a candidate for this surgery now?
Kim, that's a great question. You know, revisional surgery is growing as more and more people have different operations. Actually, in 1981, she probably didn't have our traditional, what's called a Roux-en-Y gastric bypass, and probably had a stapling of the stomach. That stapling is done very differently from the sleeve gastrectomy, so I would tell her, in short, she would be a candidate, but we would have to explore her history in more detail.
Okay, so but those revisions you're saying are growing more popular?
Absolutely. We do more and more revisions, from lap band to bypass, horizontal gastroplasty to gastric bypass or sleeve gastrectomy.
Okay. Our operators are very busy, as you can probably hear, taking your questions for our experts. Give us a call in Wake County, 919-744-3876. Outside of Wake County, call us toll-free. That number's there on your screen, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, email us your questions to rexoncall@rexhealth.com. Stay with us. We'll be right back. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions regarding weight loss surgery. To reach us, those numbers on your screen, give us a call right now. Those operators are very busy. Let's get right to it. This is Deborah in Elm City. She heard that after bariatric surgery, diabetes disappears. Is diabetes cured after surgery?
Deborah's question is common, and really the whole point of bariatric surgery is to help people with their health. It's not simply to lose weight. Diabetes is actually placed into remission 83% of the time. So it's actually the only known cure for diabetes. So when we look at, for example, treating people with insulin or oral medications, we're really putting a Band-Aid on the problem. When we help people lose weight, we actually remove the need for medications and cure them. So yes, it can be a cure, but it isn't a cure for every patient.
Okay. This is from Arlene and Zebulon. This question is for Dr. Nong because she's your patient. She's lost 118 pounds since surgery last year, which is great. In the past few weeks, she's been the same weight. She's been trying to diet and exercise. What can she do at this point to keep losing the weight?
Well, you know, Marlene knows that her success has been tremendous. She's had 120 pounds of weight loss, as she's mentioned here. And it's normal for people to hit plateaus. Everyone that loses weight in general, as you try to lose weight, you'll plateau. Specific to weight loss surgery, though, we expect you to plateau, otherwise you would continue to lose weight indefinitely. That plateau is really your body resetting the thermostat. It's your body's way of saying we need to slow things down. And how you continue to lose weight is really focused, again, on lifestyle. From the get-go, when we talk to patients about needing to change their life, and Bob can speak to this, is we can't just have an operation to make this all happen. You really need to exercise 4 to 5 days a week. You need to eat right, not just the same foods and less, but actually healthier foods with a focus on protein.
Okay, so what are the biggest changes you've made, Bob?
I think the biggest changes is the amount of food that I've eaten. As far as sweets, there wasn't a place in North Carolina I didn't know where I could get sweets. I've cut that out. But I think also is you've got to do the exercise. And that's one thing about the Rex team is when I started, as Dr. Nong said, you've got to exercise. And I need to exercise even more, but you've got to replace a lot of that weight loss with muscle gain. And so you try to also replace that muscle.
So diet and exercise. So how often are you working out, Bob?
I'm going to say 2 to 3 days a week, and I'm not going to say that that's always, I need to work out more. But I would like to work out 5 days a week. That's what I need to do.
And it's so hard to be able to change your life to make those changes. Absolutely. So we're getting a lot of calls about questions and insurance, the cost and insurance coverage. Does insurance cover this?
You know, it's a long answer potentially, but I'll try to give a brief summary. Most insurance companies are covering weight loss surgery now. You need to look at your specific plan and see if it's covered. Medicare does, in fact, cover this as well, but there are certain qualifications and rules, and you need to meet certain requirements in order to be a candidate. And we'd have to go through that with you one-on-one.
And there are some coordinators in your office and in the office that kind of help you dive into your insurance, the
Absolutely.
particulars.
We have insurance specialists as well as coordinators, both at the hospital and through our program, that can help you answer those questions.
Okay. After 5 years after lap band surgery, this is from Kim. She'd lost a total of 75 pounds. She's gained about 25 back, thinking that there's not been a restriction with her band. She chose lap band, but she's kind of wishing she'd had the gastric bypass. Talk to us about what she can do.
Well, you know, I think we always want to push patients to try to get the most out of their procedure, including the lap band. And so I'd encourage her to see her physician, or we're also happy to see her, and work with adjusting the band where appropriate, working on, again, pushing diet and exercise. That's critically important with lap band patients. On the flip side, if she's not succeeding, we do a lot of revision from lap band to gastric bypass or sleeve. And that does afford patients a little more reliable weight loss. I don't think there's much question about that. And, but again, you don't escape the need to make the committed lifestyle change.
Okay, great. Coming up, we'll answer more of your questions. Call us with one of those numbers on your screen right there, or email us your questions at rexoncall@rexhealth.com. You can also tweet us your questions at RexHealthCare, #RexOnCall. Your question may be answered here live. We'll be right back. Welcome back to Rex on Call here on WRAL. Let's get right to your questions. This is from Sandra. 18-year-old twin boys with thyroid issues. They're overweight. Are they candidates for weight loss surgery?
So let's talk about age limits in general with respect to weight loss surgery. The program in general at Rex asks that our patients be at least 18 years old. We want folks to have a certain level of maturity to be able to matriculate through the process. There is no theoretical maximum age. The oldest patient I've operated on was 76, but she was a very active 76-year-old that looked like she was 66. So I think we do pick and choose patients based on what their comorbidities and their overall health, their level of maturity, their commitment to the program, and their ability to exercise. to speak specifically to younger patients, anyone younger than 18, we generally do not offer an operation to, only in that there are programs that are specific to pediatric weight loss surgery, and I think patients are better served in that setting.
Okay, this is from Beverly in Raleigh. After surgery and weight loss, what can be done about the excess skin?
You know, Beverly, that's a terrific question. You know, a lot of patients have excess skin. That's part of the weight loss process, whether you have surgical weight loss or you lose weight on your own. Plastic surgery is certainly an option, although admittedly most insurance companies do not cover that. So I think that's an important thing for patients to recognize. In general, men actually do quite well. Women, often if women have had kids, their skin has stretched and their skin does not...
one of life's unfairness.
Yeah, the skin just doesn't hold up quite as well. Younger patients do better than older patients.
Okay, so that's something you should consider if you're going to have this surgery. You might have to follow up and it's not going to be covered.
Absolutely, and we work with our patients and can make appropriate referrals to plastic surgeons when needed.
Okay, this is from Donna in Southern Pines. She had gastric bypass 3 years ago. She's lost quite a bit of weight. She only has 5 more pounds to go. Why does the body stop losing weight? We talked a little bit about that. And is there anything she can take in pill form to help speed up that process?
Well, I wouldn't necessarily recommend she go to working to medications. I think a couple of issues to keep in mind. She needs to work with her doctor and maybe get a calculation of a percent body fat. When we talk about BMI or body mass index, it's not actually the best indicator for where you ought to be. If you actually look at your percent body fat, that's the most accurate measure of overall weight loss and success. She actually may be at her ideal body weight. If you look at her excess skin, for example, she may have up to 10 to 15 pounds of excess skin. If you remove that, or even if you don't remove that, your actual percent body fat may reflect a normal weight. So I think talking to her doctor would be very important.
Okay, this is from Nicole on Rocky Mount. The difference between lap band and gastric bypass surgery, and why did you choose gastric bypass over the other procedures?
I think it was a better opportunity to lose the amount of weight that I wanted to lose, and I don't think I could have lost that with the lap band. And plus, our conversation, Dr. Nong didn't push me to that, but did show the benefits of the gastric bypass.
So you lose more with a more invasive surgery?
The evidence is well established in the medical literature that certain operations will offer you, on average, more weight loss than others. And the lap band, what we do know about that is that you'll lose around 45 to 50% excess weight loss over 3 years, whereas I'd expect in Bob and our other patients who have gastric bypass to lose in the range of 75 to 85% excess weight loss. And many patients achieve, like Bob, almost 100% excess body weight loss with work and commitment.
Absolutely. Okay, we're going to have a final round of questions after the break. This is Rex on Call. Stay with us. Welcome back to the show. This is Rex on Call. We're taking a final round of your questions regarding weight loss surgery. And Bob, what has been the hardest thing? What's been the hardest adjustment to life after weight loss surgery?
Probably is slowing down eating. It's not so much eating the smaller portions, but just taking your time. You cannot eat too fast. If you do, you'll pay for it.
You'll pay for it. Okay. And no more sweets. Has that been a hard adjustment?
I'm not going to say 100% no more sweets, but for the most part, sweets have been cut out.
Okay. This question for you, Dr. Nong. Linda from Fayetteville. She had a stent put in her heart, and it looks like a year ago. She has hypertension, diabetes. She's 65, 5'2", weighs 182 pounds. Can she have gastric bypass surgery?
At 5'2" and 182 pounds, she probably would not qualify. We'd need to calculate her BMI.
Okay.
Her comorbidities are all the things that we would certainly be hopeful that weight loss would help her with. And even if she doesn't have weight loss surgery, weight loss will help reduce her risk in the future.
Bob, did you have any health problems before weight loss surgery?
I was taking a statin. I had my cholesterol was a little high, and basically got off of that as soon as I had the surgery.
Oh,
so I've had no problems.
Amazing. Okay. Samantha wants to know, can you have weight loss surgery with a colostomy bag? She had it for about for colon cancer, so she has a colostomy bag.
Absolutely. There is no contraindication in that setting, and I'd encourage her to consider it.
Okay. Can you have surgery if you're on dialysis?
That is, yes, is the short answer. The more complicated aspect to that is needing to work with your nephrologist to make sure that you don't have other issues that are going to prevent you from being a safe candidate for surgery, because we don't want to do surgery without making sure you're absolutely safe.
Okay. As this is from Carol in Fayetteville, she was diagnosed with IBS. Does this cure the constant bloating?
This will not cure your issues with IBS. There's certainly not a reason to avoid surgery, but I wouldn't approach weight loss surgery as an answer to your IBS.
Okay, is there of the 3 procedures, is there a best one for a diabetic?
You know, in my opinion, there is. I think there is a little bit of debate. I think in general terms, we all agree that losing weight is the overall best answer. For diabetics, I do recommend that patients more strongly consider something like the gastric bypass. It's actually one of those operations in which you may have your surgery, and before you leave the hospital, before you've lost 20, 30, 50, or 100 pounds, your diabetes has been cured. And in fact, we see in about 25% of our patients going home off of all their diabetic medications. So there is a metabolic aspect to the operation beyond simply weight loss.
Okay. And Bob, I'm assuming you tried diet and exercise before this surgery.
Very much, just about all.
Just about all. And so what's the difference between sticking to it now and making it work now?
I think the surgery itself helps to keep you from eating. You're not allowed to eat as much. So it's a way for it to control that.
Yeah, the surgery is a very, very powerful tool. It, to some extent, eliminates hunger for a period of time. So you have a honeymoon period where you aren't a slave to your cravings and your hunger, and it also allows you to reorient yourself. We have to push pretty hard with our program, and we work with Bob and all of our patients to, again, focus on lifestyle, focus on exercise. You know, yes, 2 to 3 days in a busy professional like Bob is putting a lot of effort, but we still are going to push and expect more.
Okay. And so is this, when we're talking about diabetes, is this type 2 diabetes we're talking about?
This is type 2 diabetes.
Okay,
absolutely.
just to clarify, just want to make sure. And here's another one, can't seem to lose 60 pounds. Is she a candidate? She's 148 pounds, and she's, and she wants to know if Medicare or Medicaid covers this.
Both Medicare and Medicaid do cover some bariatric surgery. Again, there are very specific qualifications. At her weight, if I'm reading,
yeah, it depends on her height.
Right.
We didn't get the height.
Is she saying she's 148 pounds overweight, or is she saying she's 148 pounds? You know, I think the real issue comes down to are you over 100 pounds or so over your ideal body weight?
Okay, so this is from Janice in Raleigh. She actually had lap band surgery about 1.5 years ago and only lost 10 pounds is what I'm reading. Can she go back and have another procedure?
So like our other patient who had lap band many years ago, revision is absolutely an option. You know, I think, again, looking and speaking with your doctor or having a consultation with one of the rec surgeons, I think would be valuable to help you understand the best direction to go.
Okay, and as always, you're going to consult with your physician on any health concerns. And thank you guys very much for coming in and answering these questions. And thanks to their phone bank, they're still taking our calls. Before we go, we have some important details about the 2013 Rex Hospital Open. We're throwing a golf tournament, but don't be surprised if a party breaks out. Join us on the web.com tour and be part of the action at Raleigh's premier golf tournament, the Rex Hospital Open, June 20th to the 23rd at TPC Wakefield Plantation. This is a family-friendly charity golf tournament, and it's raised more than $7 million for patients in need right here in our community. And these guys are good. Now, 3 out of the 4 of the PGA players playing here on the path to the tour, they end up on the PGA Tour. So for ticket information, check out rexhospitalopen.com and rexhealth.com/rexopen. And as a reminder, our next show, our next Rex on Caller topic will be orthopedic injuries on the court, on the course or the field, or even in the backyard. That's Monday, June 17th at 1 p.m. Email us your questions. We'll see you then.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management